You are here to also talk about mental health. That's a very relevant issue that we're facing right now. And I want to know more about mental health. Can you tell the viewers about mental health?
Thank you so much, Miss Wendy. So mental health is very trendy right now, and the latest issue is all about the mental health issues and concerns. It could be depression and anxiety, especially with this pandemic that we had, COVID-19. So there's like I see a lot of transitions with my patients that I see in the clinic, and also the students that I cater to on how things are before pandemic, after pandemic, and during pandemic. So when we say mental health, this is your capability to cope and adjust to different stressors and different changes in life. So you are capable of adjusting to it and responding in a positive way, then that's being mentally healthy. When you say being mentally unhealthy, is that you are unable to adjust to stressors and you cope in such a way that it's a negative connotation on your part. And your relationship, your work, and also your relationship with yourself is affected to a point that all your activities are altered.
That is right. Because I've been doing a lot of research on mental health. And for me, I want to be one of the advocate of that because that's one of the number one killer. And it hasn't been discussed, right? There's like a stigma. Like if you talk about mental health, like it's more of psychological, psychiatric that you need to go to mental facility, right? So what can you tell about the people, especially I think one every five people have some mental health issues.
That's true. And there's like a lot of stigma about mental health. And we want to destigmatize this concept about mental health. So having a mental health issue is not, we have to make sure that we are open about it. We are open to talk about it. We are very open about talking about our kids going to school, about our job. We got this house, we got this car. But when we talk about mental health, nobody wants to talk about it. And I think we have to have an open door policy. And now is the right time. And always remember that seeking mental help is not a weakness, it's actually being brave. It's actually a celebration that you know with yourself that you need to seek help. And it's always a bad idea to seek mental health at the latest. Means if you see something like you feel signs and symptoms about depression and anxiety that we will talk about today, ask for help. There is help. It's not a sign of weakness. It is okay not to be okay. And we are here to support you out. As long as you have the proper support with your family and your mental health professionals, we are here for you.
Wow, that's great. So, Peter, Dr. Peter Morante, sometimes you need to be in a social economic status. Like if you're rich or wealthy, they can just go to their doctor or they just wanted to get an appointment for an hour just to talk about, their issues. But what about those people that don't have access to healthcare, like don't have access to any people that they can talk to and talk about their probably depression, their anxiety, those post-traumatic syndrome, and especially what happened during COVID. Can you talk about it, where they can find help, especially with those people that don't have any healthcare access?
So remember, accessibility to mental health is now a trending issue also. So there's a lot of platforms that you can venture into. Aside from insurance, of course, there's like an advocate for it. You could see your provider actually now through telehealth. And at the same time, there's a lot of resources that we can give for them, and also support groups. It's not only limited to having those things, but also support groups are important key of your mental health also.
That is true because as I always check on YouTube, on the newspaper, that's the one leading cause of death, right? Even in Hollywood, there's gonna be, it doesn't need to be anxiety, depression. It can be alcohol abuse or drug abuse. So what are the signs and symptoms? Like, do they have to wait? Like, how can they know that they needed help and they need to seek help and talk to other providers or people?
Thank you so much. That's a very good question. So remember, our body is made holistic in such a way that the body, the mind, and the soul should go together, coincide. It's like a car, right? When you're driving, when you're driving a car, all of the gas, the brake, and also the oil filter should work appropriately. So it's like our body. When our body, our mind, and our soul or our emotions are not in balance, then that's the time wherein you feel the symptoms. You could feel very uneasy just going to the store, and you feel like